Bunions. Bunions or hallux valgus are bony lumps that can develop on the inside of the foot beside the big toe. This can cause the big toe to turn slightly inward. Causes. Wearing tight or narrow shoes can cause bunions to develop. Tight shoes put pressure on the metatarsophalangeal joint, which is where the bone of the foot meets the bone of the big toe. Having a family history of bunions is also a risk factor. There is a family history of bunions in about 70% of cases, according to the American Academy of Orthopedic Surgeons. Additionally, some conditions including rheumatoid arthritis and polio can increase the likelihood of developing a bunion. Symptoms. Bunions are cause a visible lump bump on the side of the foot, tenderness on or around the big toe, a cone or callus on the bone below the big toe, difficulty moving the big toe, pain in the big toe when walking. Treatment. Conservative treatment measures will usually improve the symptoms of a bunion. A person should wear properly fitting shoes without high heels. They can also buy a bunion pad to protect the bunion from extra pressure. A podiatrist can prescribe custom-made shoe inserts or a splint to help straighten the big toe. If the bunion does not subside and causes continued pain, they may choose to have surgery to correct it. Diabetic neuropathy. Diabetic neuropathy refers to nerve damage in people with diabetes. The condition typically affects the feet and legs, but it can also affect the arms and hands. Causes. Over time, high blood sugar levels can damage the nerves, especially those in the feet. Other factors can make this nerve damage worse, such as having overweight, high cholesterol, high blood pressure, advanced kidney disease, smoking cigarettes, excess alcohol consumption. Symptoms. Symptoms of diabetic neuropathy include numbness, tingling, pain, reduced sensation, which can increase the likelihood of cuts or injuries. Treatment. Managing diabetes and blood sugar levels can help a person treat diabetic neuropathy. While a doctor cannot reverse nerve damage, they can recommend treatments to prevent it from worsening. A person with diabetes should also go for regular foot exams. They may wish to have their toenails professionally trimmed and seek medical attention if they identify any foot wounds. Ingrown toenails. Ingrown toenails occur when the toenail starts to grow into the nail groove, which can cause significant pain and discomfort. Causes. Wearing footwear that does not fit properly can cause ingrown toenails. The pressure from shoes that are too narrow at the top or too tight can put extra pressure on the toes. Other causes include toenails that are not trimmed properly, such as cutting the toenails too short or trauma to the feet due to activity including running. Symptoms. Ingrown toenails will cause swelling, tenderness, pain, pus due to infection. Treatment. There are several ways to treat and prevent ingrown toenails, including soaking the feet in warm water and gently drying them, wearing comfortable footwear, taking pain relief medication. If home remedies do not help, or if there is an infection, a person should contact a medical professional for advice. The medical professional may need to remove a portion of the toenail and prescribe antibiotics to treat the infection. Plantar fasciitis. Plantar fasciitis is one of the most common causes of pain on the bottom of the heel, according to the American Association of Orthopedic Surgeons. The condition occurs when the plantar fascia on the bottom of the foot becomes inflamed. This ligament is responsible for supporting the foot's arch. Causes. Plantar fasciitis is an inflammatory condition that usually does not have a clear cause. However, certain factors may increase the likelihood of developing the condition. This include being between the age of 40 to 60 years, obesity, beginning a new activity, increasing activity levels, spending a lot of time standing, particularly on hard surfaces, having either a high foot arch or flat feet, tight calf muscles. Symptoms. Plantar fasciitis causes a person to experience pain on the bottom of the heel. This pain is usually worse first thing in the morning or after a period of rest. The pain can also worsen with activity. Treatment. Most people can manage plantar fasciitis with at-home remedies. This include resting the foot and applying ice can reduce inflammation. Taking non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen to manage pain. Stretching the foot thoroughly before and after physical activity, as well as throughout the day to help to reduce heel pain. Wearing supportive footwear. If an individual's plantar fasciitis does not get better with these treatments, a medical professional may recommend physical therapy. Steroid injections may be necessary to reduce inflammation. A doctor may also prescribe custom-made orthotics to provide extra support to the heel. Blisters. Blisters are raised fluid-filled pockets in the skin. They usually develop when something causes chafing against the skin. Causes. Foot blisters can develop after walking or running for long periods of time, especially if the feet have become sweaty or when wearing shoes that do not fit correctly. Symptoms. Blisters can cause pain, tenderness, discomfort. They will usually appear as clear fluid-filled bumps. However, blood blisters will look red or black. If the blister develops an infection, it may look green or yellow. Treatment. Most blisters will heal on their own within 1 to 2 weeks. Steps that can help manage pain and other symptoms include wearing sock and soft bandages to protect the area, keeping the area clean, avoiding popping the blister as this can cause more pain and lead to infection. If a person notices signs of infection, they should contact a doctor for advice. An infection can cause warmth, green or yellow pus, redness or discoloration around the blister. Corns. Corns are patches of thickened skin that commonly develop on the balls of the feet and the tops and sides of the toes. Causes. Common causes of corns include wearing high heels, wearing uncomfortable footwear, wearing footwear that does not fit properly, wearing footwear without socks. Symptoms. Corns develop as small lumps of skin. They may be firm or soft, and in some cases they can cause pain. Treatment. Treatments for a corn can include soaking the foot in warm water for about 5 to 10 minutes at a time, gently feeling the corn with a pumic stone to remove dead skin, regularly applying moisturizer to the area, wearing footwear that fits properly, keeping toenails trimmed as toenails are too long can cause the foot to push up when wearing footwear. In some cases, a doctor may recommend surgical removal. Heel spur. A heel spur or calcaneal spur is a bony growth that can develop on the heel. Causes. A heel spur may develop due to long-term strain on muscles and ligaments. Conditions and factors that increase the likelihood include rheumatoid arthritis, osteoarthritis, gout, ankylosing spondylitis, having overweight. Symptoms. For many individuals, there are no symptoms. In some cases, a person may have heel pain. Treatment. A person may not require treatment unless the heel spur causes pain. In some cases, it may be necessary to surgically remove the heel spur. Claw toe. Claw toe, also known as a claw foot, is when the first toe joint points up and the second toe joint points down. Causes. Claw toe usually develops as a result of nerve damage. Possible causes include diabetes, stroke, alcohol use disorder. Physical injury and inflammation can also cause claw toe. Symptoms. Claw toe causes the toe to bend upward at the joint closest to the ball of the foot. The middle joints bend downward. In some cases, the joints at the top of the toes may also bend downward so that they are curling under the foot. Treatment. Treatments for claw toe can include wearing shoes with wide toe boxes, avoiding tight footwear, toe exercises and stretches. Metatarsalgia. Metatarsalgia is pain in the ball of the foot. It can affect the whole width of the foot or only a small area. Causes. Causes of metatarsalgia include arthritis of the big toe, bunions, wearing high heels, wearing footwear with thin soles, running and other high-impact sports, having arched feet, having overweight. Symptoms. Symptoms of metatarsalgia can include burning, aching, a sharp shooting pain, feeling like there is a stone in the shoe. Treatment. Treatments generally include resting, wearing flatter or wider footwear, wearing an insole with a metatarsal dome, choosing low-impact exercises over high-impact exercises, maintaining a moderate weight to reduce pressure on the foot. Foot problems, causes and treatment. Different types of problems and conditions can affect the feet, from inflammation to injuries. This include athlete's foot, bunions, diabetic neuropathy, ingrown toenails, and more. If a person has concerns about problems affecting the feet, it is best to contact a doctor for an accurate diagnosis. The doctor can advise on suitable treatments to manage symptoms and address the underlying condition. Watch on to learn more about the symptoms, causes, and treatments of common foot problems. Athlete's foot. Athlete's foot, or tinea pedis, is a fungal infection of the skin, usually between the toes. However, the infection can spread and cause significant discomfort, itching, and even pain. Causes. An individual is most commonly exposed to the fungus that causes athlete's foot in a locker room, shower, or pool where people walk around barefoot. Fungus tends to thrive in warm, damp areas. Wearing shoes that are warm and damp can cause the fungus to grow and spread. The condition is highly contagious and it can spread to other areas of the skin, including the hands, groin, and scalp. Symptoms: athlete's foot causes itching, cracking, blistering, peeling of the feet. Treatment: antifungal treatments are available in most drug stores as sprays, powders, or lotions to apply to the feet. A person should keep their feet clean and dry them with a separate towel. If the fungus is spreading or worsening after treatment, a person should contact their doctor. They may prescribe oral antifungal medication.